Welcome to this video that has been brought to you by the Mental Health and Learning Disabilities team. In this video, we will give a brief introduction of the Care Act and talk about what it means for people with learning disabilities and their families. The Care Act is a law that looks at how people who need care and support are looked after. The Care Act gives guidance to local authorities about what people are entitled to and how to ensure the local authorities can provide this to meet people's needs. The main focus of the Care Act is to promote independence and well-being. This means that everybody should be able to live as independently as possible, ensuring that they have a high quality of life. There are a few things to know about the Care Act. These are that individual well-being is the main focus for decisions made under the Care Act, that the aim of support is to reduce or prevent need and to promote independence, that information and advice must be available to people who need it, that people will have the right to an advocate if they need one, and finally, that carers also have an opportunity to carers assessments and support if they need it. What do we mean by promoting well-being? When we talk about well-being, it can be hard to describe what that means because it will be different for each individual. The term well-being can be understood by looking at lots of different factors, keeping the person at the centre of all of these. These are physical and mental health, emotional well-being, control over my life, economic well-being, protection from abuse, having a place to live, participation in society, such as school, work or recreation, social interaction, relationships, and dignity and respect. The Care Act means that local authorities have to consider all of these factors when making decisions about people's care. When we talk about preventing a care need, we're talking about trying to stop problems before they start, or by stopping things from getting worse. It means making sure the support in place for somebody is appropriate, so that their needs don't increase and they remain as independent as they can. For example, having a support worker to help somebody go to an activity, rather than them staying inside with no stimulation, would increase their independence and well-being and could prevent that person needing further care and support in the future. When we talk about reducing care needs, we are not talking about taking care away from somebody that might need it. What we mean by this is making sure that the care somebody receives is appropriate and gives them the most independence. One way to reduce care need might be to teach that person new skills. For example, somebody who relies heavily on taxis to get out and about may be able to learn the skills to travel on public transport independently. This would mean they would be less reliant on waiting for a taxi to pick them up, and they would have the skills to go out when they wanted to wherever they wanted to go. Another key part of the Care Act states that local authorities need to provide clear and accurate information and guidance about care and support in the area. This also means presenting that information in a way that is accessible to everybody, for example, giving information in an easy read format. The local authority can give information and advice about lots of things, such as the types of care and support available, how to access care and support, how to raise concerns about safeguarding, information about funding for care and support services, and where you can access independent financial advice and support. Under the Care Act, carers are entitled to ask for an assessment for carer support. The definition of a carer is somebody who provides regular unpaid support to somebody who is unable to manage alone. This could be 24-hour care for somebody who lives with the carer, such as a family member, or it could be for a few hours each day if the person being cared for lives somewhere else. A carer's assessment will be carried out by the local authority to see if a carer is eligible for support and what kind of support can be provided. Support for carers might look like respite, where somebody else helps with care duties that gives the carer a bit of a break, advice about carer support groups available in the area, help with daily living tasks such as housework, or resources for information and advice. Sometimes it can be difficult to ask for help, but caring for somebody is a big responsibility and it's okay to ask for help if you need it. During a carer's assessment, the person carrying out the assessment will ask lots of questions about that person's role as a carer and the impact that can have on their life. There are lots of things being a carer can impact, such as physical, mental and emotional well-being, relationships and social activities, work and education opportunities. Once the assessment is completed, if somebody is eligible for support, then a carer support plan will be made, which will contain details about needs, how support is given, how their needs will be met, and the impact the support will have on that person. If you are thinking about asking for a carer's assessment, some things you can consider are Do I want to, or am I able to continue caring for the person I care for? Is there a chance that I may not be able to care for them in the future? Is there anything that could make my life easier when caring for somebody else? Do I have a physical or mental health condition that could make caring for somebody difficult? And does being a carer mean I miss out on opportunities or activities, such as education, work, or social interaction? If you would like more information, you can visit any of these websites: MenCap, British Institute of Learning Disabilities, and Foundation for People with Learning Disabilities. You can also contact a social worker or your local authority to find out more information about the CARE Act. Additionally, you can visit the Lambeth Mental Health and Learning Disabilities team webpage, where you can find additional resources. There will be a link to this webpage in the video notes below. Thank you for watching our video.